For over 20 years, the medical establishment committed one of the most egregious oopsies in modern history. If you're a woman between 40 and 60 weighing menopause hormone therapy in Sarasota, you've likely spent 2 decades being terrified of the very thing meant to keep your brain, bones, and heart from turning into dust. Hormone therapy, more specifically bioidentical hormone replacement therapy, BHRT. In late 2025 and early 2026, the FDA quietly, and I mean very quietly because nobody likes to admit they were wrong for a generation, removed the infamous black box warnings from most menopausal hormone therapy, MHT, products. They finally admitted that the heart disease, breast cancer, and dementia scares were based on a colossal misreading of data. The fear was fake. The suffering was real. As the nutrition ninja doc, I've been shouting this from the rooftops for years. While mainstream medicine was busy scaring you into a state of estrogen-deprived decay, I was looking at the actual biochemistry. Let's break down what finally changed in 2026 and why everything you thought you knew about bioidentical hormones in perimenopause, menopause, and postmenopause was likely a lie sold to you by a panicked bureaucracy. In 2003, the FDA slapped a broad class warning on all estrogen products. Why? Because of the Women's Health Initiative, WHI study, a study that, in retrospect, was a masterclass in how not to do science. They took women with an average age of 63, most of whom were already showing signs of cardiovascular decay, and gave them horse urine, Premarin, not human bioidentical estradiol, and synthetic progestins, not progesterone. When these older women started having health issues, the FDA panicked and told 45-year-olds in America they'd get cancer or heart disease if they chose to use these hormones. This could not be further from the truth. Beginning in November 2025, with the updated labeling rolling out through early 2026, the FDA finally deleted those warnings for cardiovascular disease, stroke, and breast cancer for typical candidates. They realized that treating a healthy 50-year-old like an ailing 75-year-old is scientific malpractice. According to data from Truveta, HRT prescribing has more than doubled since 2018 because the truth is finally leaking out. Estrogen is not the enemy. In the world of age reversal, timing isn't just a factor, it's the factor. The new 2026 labeling emphasizes what we've known all along, the window of opportunity. If you start hormone therapy before age 60 or within 10 years of your menopause onset, the risk-benefit profile isn't just okay, it's super physiologic. We are talking about a massive reduction in all-cause mortality, protection against osteoporotic fractures, bone health, significant cardiovascular protection, preserving cognitive function, preventing brain fog. Wait too long, say until you're 75 and your arteries are already lined with the remnants of 20 years of big food choices, and the risks change. BHRT can still provide benefits, but not as well as it will in a 50 to 70-year-old. But for the woman in perimenopause or early menopause, estrogen is metabolic currency. One of the biggest breakthroughs the FDA finally acknowledged is that how you take your hormones matters. Mainstream doctors love to hand out oral pills. Why? Because it's easy. But when you swallow a hormone pill, it has to pass through your liver first, the first pass effect. This kicks up inflammatory markers and increases the risk of blood clots. In fact, oral estrogen carries a meaningfully higher venous thromboembolism risk than transdermal delivery. At ARTC, we prioritize transdermal delivery, patches or creams. By bypassing the liver, we eliminate that elevated clot risk. It's cleaner, it's safer, it's how the body actually expects to receive these signals, and it's the default for menopause hormone therapy in Sarasota at ARTC. If your doctor is still pushing oral estrogen in 2026, you're not getting health care. You're getting a dinosaur's opinion. Mainstream medicine treats menopause like a temporary symptom to be managed. Oh, you're having hot flashes? Here's a low dose for a short time. This is nonsense. Menopause isn't a deficiency of symptoms. It's a fundamental collapse of your regenerative capacity. When estrogen drops, everything starts to break. Your bones lose density, your skin loses collagen, your brain loses its spark, and your risk for heart disease skyrockets. Our approach to menopause hormone therapy in Sarasota isn't about just stopping the sweats. It's about systemic protection. Brain health, estrogen is neuroprotective. Without it, your risk of cognitive decline increases. We integrate this into our brain health protocols. Cardiovascular integrity, estrogen helps keep your arteries flexible. Hardened arteries lead to more than just heart attacks. They lead to a slow decline in vitality. Bone density. You can drink all the milk big dairy sells you, but without estrogen, your bones won't hold on to that calcium. We don't do one size fits all. The FDA finally realized that class warnings were a mistake, and we've known that class treatments are a mistake from day one. It's why our approach to menopause hormone therapy in Sarasota starts with your labs, not a template. We use bioidentical hormones, molecules identical to what your body produced naturally, not synthetic approximations. We combine this with our proprietary age reversal protocols and our broader hormonal and sexual health programs for men and women to ensure your body is in an anabolic, regenerative state rather than a catabolic, degenerative slide. This isn't rocket science, it's biological common sense. We look at your blood work, your lifestyle, and your specific goals to create a customized roadmap for your second half of life. Because let's be honest, 60 is the new 40, but only if you have the hormones of a 40-year-old. The FDA's 2026 course correction is a win for women, but it's 20 years too late for many. Don't wait for another decade of studies to tell you what your body already knows. If you're struggling with the transition of perimenopause or menopause, or if you just want to stop the aging clock in its tracks, it's time to look at the real science. Stop settling for normal for your age. Normal for your age is a slow decline into frailty. I prefer a different path.